Rheumatoid arthritis doesn't narrow your chance of having a baby, but it might make pregnancy more uncomfortable. Fortunately, about 70 to 75% of the time, rheumatoid arthritis flares subside dramatically by the 4th month of pregnancy. However, the symptoms will come back about 2 to 8 weeks post-childbirth. The remaining 25 to 30% of pregnant women who continue dealing with RA symptoms do have drug treatment options. Ideally, women don't take any drugs during pregnancy or breastfeeding. Using a combination of exercise, bed rest, ice, and heat packs, as well as splints, will help relieve RA pain. But avoiding medication completely isn't always possible. Doctors have determined which drugs will probably not cause health problems or birth defects and which ones might. Non-steroidal anti-inflammatory drugs, or NSAIDs, such as aspirin or ibuprofen, are okay to take for the first 2 trimesters, but should be stopped in the 3rd since they may cause labor complications. Low-dose corticosteroids, usually prednisone, are also safe, as is hydroxychloroquine. Pregnant women may take sulfasalazine, cyclosporin, and azathioprine. All 3 are disease-modifying anti-rheumatic drugs known as DMARDs. Most of the other drugs in this class, including methotrexate, etanercept, infliximab, and adalimumab, are not safe for pregnant women. If a woman is allowed to take a drug during pregnancy, she's almost always allowed to take it while nursing as well. If you're trying to get pregnant, it's a good idea to adjust your treatment plan sooner rather than later, and men with RA who are trying for a baby with their partner may also have to swap their medications since certain drugs affect sperm cells. Consult with a rheumatologist and your OB/GYN if you have RA and want to get pregnant. Your team of doctors will tailor a treatment plan specific to your needs.